Hi everyone, I'm Marl Salerno, functional diagnostic nutrition practitioner of reclaimoptimalhealth.com, where I help couples just like you resolve their infertility and get back to creating those families you so deeply desire. Now, if you have been struggling with infertility and you have experienced miscarriage or recurrent pregnancy loss one or more times, then this video is for you. Now, if I could ask you for one small favor and click that subscribe button down below so that you can receive every week updates of when I post fertility boosting videos. Now, miscarriage is devastating, absolutely devastating. And if you have experienced miscarriage, you know the exquisite pain that comes with it, as well as the fear it projects into future pregnancies. Now, unfortunately, miscarriage can happen really at any age. So age is not the determining factor, but there's a lot of other factors to take into account, which we'll go through in this video. Now, instead of focusing on the fear, if you can with me, try to let go as much of the fear as possible and actively focus on all the positive things that you can do to help boost your fertility and reduce the chances of recurring miscarriage. Now, when couples come to me and they've had one miscarriage, what I do is I help them to identify all the stressors that are impeding on their ability to conceive. And the way that we do that is we utilize a lot of lab testing, as well as just me digging and asking a lot of questions into their lifestyle and their health so that we do a really thorough analysis and investigation. Once we identify the stressors, then we can reduce and eliminate them. And I actually go through great lengths to explain this to you in my free fertility boosting guide, and you can get that down in the description box below. And I also give you in that guide 5 tips to help boost your fertility today. Now, they come to me, and once we identify those stressors and we eliminate them, we also help to really revamp their lifestyle and mindset in order to also reduce more stressors, but help them manage the stress they do still have. When couples come to me and they've had 2 or more miscarriages, then I highly recommend them to stop trying to conceive. And the reason is because conception and just pregnancy in general, regardless of wherever you are on the spectrum, it requires a woman's body a ton of energy and nutrients. So every time you try to fall pregnant and then you have a miscarriage, the body has to go through a whole healing process. And if you are rushing into conceiving again and again and miscarriage keeps happening, then nothing's really changing. And so that's where I think of that quote, that the definition of insanity is doing the same thing over and over again and getting the same result. So when it comes to miscarriage, you really want to make sure you give the body a solid rest of at least 4 to 6 months, because we know the maturation and the development and the movement of sperm and egg happens within a 4 to 6 month window. So you really want to give the body really good rest. And then of course, I address with couples that have had 2 or more miscarriages to address their nutrition, to address any of their toxic load, to address their mindset, to address their exercise and their movement so that they're actively focusing on things to improve their health that in turn improves fertility success. Now, there is a myriad of conditions that are associated with infertility, like luteal phase dysfunction, for example. It's a fancy word for just saying that you have low progesterone levels in your luteal phase, or hormonal imbalances in general. Polycystic ovarian syndrome is another one. Infections, diabetes, undiagnosed hypothyroidism, any kind of abnormalities of the uterus, as well as immune system weakness or even just autoimmunity in general. These can all be contributors to infertility, but you can always improve upon all of those diseases in the body, and as a result, improve your fertility success and decrease the chances of miscarriage. Now, the one that I want to focus on is actually genetic mutations. And this especially is something I like couples who have experienced miscarriage 2 or more times to investigate thoroughly through lab testing. So there's a lab test that's called MTHFR, which is referring to methylene tetrahydrofolate reductase. And what that's referring to is genetic mutation. And that genetic mutation actually creates high homocysteine levels. And basically what that means is that you have a decreased level of B12 vitamins and folate, and you actually need to be supplementing with them in a methyl form in order for you to render them. And that's extremely crucial for helping to decrease miscarriage and recurrent pregnancy loss. Now, of course, there's all these symptoms and all these diseases that can be contributing to infertility. But bar none, what you need to take care of when it comes to miscarriage, if that is what is happening, is your preconception health. You've got to focus on that, both yourself and your partner. You've got to get your nutrition right for you by avoiding foods that you're intolerant to, but increasing all those foods that are full of antioxidants, like vegetables and fruits that are high in the rainbow of colors, and making sure that the fruits that you are consuming are low in sugar. So sticking with the fruits that are like berries or green apples, things like that, so that you're not messing with your insulin levels, because most people actually are pre-diabetic in cultures around the world these days, unfortunately. You're going to also want to avoid gluten, dairy, and soy because they are highly inflammatory. And inflammatory foods really increase infertility because they affect the quality of the egg and the sperm. And that's, of course, going to affect miscarriage. Really reducing your toxic load. So looking at all your lotions and your potions, your self-care products, your cleaning products in your home, and really cleaning them up. And honestly, what I highly recommend is minimizing the amount of things that you use, and the things that you're using, having them in the simplest form. For example, if you're using face cream, use a face oil like apricot oil, for example. One ingredient. You can control it really easy, super clean, and it's gonna have such a wonderful effect on the body instead of a harmful effect. Now, talking about toxic load is making sure that you keep the liver really detoxifying as much as possible on a regular basis, because the liver is a master detoxifier. So things like greens are great for the liver, dandelion root, lemon water, castor oil packs, just really making sure you're taking care of your liver. And another way to move the liver is through movement itself, through exercise. And making sure that exercise, if you can get a light sweat, that would be wonderful. But really making sure you feel excellent after you exercise. If you ever get the feeling that your heart is pumping in your head, you can feel it booming, or in your chest or through any part of your body, that's usually a telltale sign that your cortisol levels are rising. And remember, cortisol is your stress hormone that is catabolic, meaning it breaks the body down. Whenever the body is getting broken down, that means you're affecting your fertility in a negative way, right? You're boosting infertility, and that's going to boost miscarriage as well. And then, of course, making sure you're tending to your mental, emotional, and spiritual state, because we know that healthy women are those that know how to manage their stress well. They have great coping mechanisms in place, and they know how to eliminate the stressors they don't need in their life and learn to manage the ones that they have to have with more ease. So I hope this was helpful for you all. I know miscarriage is really difficult, and there is a huge community and a huge support of people out there online, especially these days with everything that's going on in the world. Please reach out online, cultivate a community, and really tend to your heart and to your mind and to your spirit. Release the fear and really grab on to all the active and positive things you can do to reduce miscarriage and boost your fertility success. So until next time, I'll see you then. Bye-bye.